Side effects. Well, first of all, the non-specifics. Nausea, any medication can cause nausea. Headache, diarrhea, dizziness, fatigue. Those are very non-specific side effects. A big one, though, for these agents is sedation. And we think this is mediated by these medications' antihistaminergic effects. So they're essentially antihistamines. And so they block the H1 type of histamine receptor, the type that's involved in seasonal allergies, not the type that's involved in your stomach acid. We're talking about blocking the H1 receptors. They are found in the central nervous system, and they result in sedation, which can be very significant. Mirtazapine is a tetracyclic, a little bit more modern antidepressant that's used a lot, and it too creates sedation through its antihistamine effect. So you want to dose these medications at bedtime. You want to try to use them as sleep agents as well as antidepressants. And if you do have to dose them throughout the day, you want the larger dose to be at bedtime. Weight gain is another real problem with these agents. They increase the appetite. They don't change the metabolism. They increase the appetite, especially for carbohydrates. For some reason, you're not going to crave broccoli, but the pastas and the sugary sweet foods, you're really going to want those more, and you're going to gain weight from that, and it could cause metabolic syndrome, type 2 diabetes, hypercholesterolemia, elevated cholesterol, as well as a bad ratio of the quote-unquote good cholesterol to the bad cholesterol, dyslipidemia. You really do have to weigh patients at baseline and monitor them very carefully. That's a huge drawback and a deal breaker for a lot of patients. They also, all of them, to some extent or another, block muscarinic acetylcholine receptors. So they're anticholinergic, and you get all of the side effects that go with that, from dry mouth to constipation. To urinary retention, to blurred vision. Blurred vision because it impairs accommodation. So you get blurred near vision. The pupils can't accommodate. All of these medications can cause sexual dysfunction, mostly anorgasmia and a lowered libido because of the serotonergic actions, but you can also get erectile dysfunction. That could be a consequence of a low libido, but it could also be a direct effect of norepinephrine, which inhibits the parasympathetic nervous system and interferes with the erection. In a lot of men, particularly men that are middle-aged, they might have other risk factors like cardiovascular disease, chronic hypertension, etc. Orthostasis, orthostatic hypotension, is a loss of blood pressure, a drop in blood pressure in the cranium upon standing. Ortho means upright, erect, stasis, to stand. And so when you get up, especially if you've been lying down or even sitting down, and you come to a standing position, the blood pools due to gravity, and your vasculature is supposed to compensate by constricting to maintain pressure, but you get interference with that system with these medications, and that can lead to dizziness and even fainting and falling. We do see severe hypotension in overdose. You want to get a baseline EKG in your patients that are older than 50, because these agents can also cause QTC prolongation. QTC stands for the corrected QT interval, and that refers to the electrocardiogram, the QRST complex, which measures in milliseconds the length of a heartbeat. So in patients who already have varying degrees of heart block, you want to avoid using tricyclic agents, or in patients that already have arrhythmias, because prolongation of the QTC could lead to fatal arrhythmia, a torsade de pointes, which looks like this and looks like this. Again, these medications are fatal in overdose. You see seizures, arrhythmias, fatal arrhythmias, coma, and death. Definitely not a good choice for patients that are chronically suicidal or the patients who are prone to overdose. Other side effects include sweating, increased sweating. because you have the increased norepinephrine, and so upon exertion. But also you could, in theory, have hot flashes as well, temperature dysregulation. That's due to increased serotonin. I have another video, it's an instant replay on sweating, on drug-induced sweating, so you can check that out for more information. Heartburn has been reported, a weird taste in the mouth, that can happen. These are not as common. Akathisia, which is a motor restlessness, a fidgetiness, a need to move and feeling very uncomfortable if you can't move. In the extreme, it takes the form of pacing, but probably more commonly you would see fidgeting, squirming, inability to stay seated, maybe a bouncing knee or a tapping toe. That's called akathisia, and it's due to increased serotonin, which is antagonizing dopamine in certain regions of the brain. You can also see rarely the induction of mania in those individuals who are susceptible to it. So patients with bipolar spectrum illness, you're not going to see mania in patients that aren't prone to manic episodes. Even in overdose, you're not going to see mania unless you have a person who's bipolar. And similarly, patients that are vulnerable to psychosis would be at increased risk theoretically, but this is rare. Rarely you see photosensitivity. Controversial side effect would be suicidal ideations. Any antidepressant, in theory, especially in young, impulsive people, could, in theory, increase suicidal ideations and even behaviors. This is controversial. It's not really been proven. I am on the side of there's really very little proof of that, and I certainly don't worry about it in really any of my patients. Definitely not in patients that are older. But I warn all patients about it. I ask all patients about suicidality, whether they've had problems with depression or not. And I do caution them that if they start to have thoughts, weird thoughts, to let me know. In a young, impulsive patient, you really do have to be careful about that. And these medications are generally contraindicated. They're relatively contraindicated in any patient with cardiac impairment. That means anyone who's had a recent heart attack, or who has problems with their rhythm, pre-existing arrhythmias, any degree of heart block, patients who perhaps have bradycardia, which is a very slow heart rate. I would be very loath to prescribe a patient with any of the above, any kind of heart disease, a tricyclic agent.